On a personal note, I have a hemorrhage in my sinuses that it happened today on the mountain where I get super lightheaded and I leak
Oh my gosh.
cerebral spinal fluid through my nose. And I don't have health insurance. My dad is out of the picture, and my mom is not in a she's disabled and not in a position to provide for me on her health insurance. So it's been happening for over a year now.
How old are you?
And 23. So I have that problem, and then I'm also wearing a giant metal exoskeleton, I guess, on my knee right now, or else I wouldn't be able to ski today because I sprained my knee 3 times in the past year. And I basically I haven't met the doctors in 3 years, basically can't afford it. So I'm out of the picture on insurance. I can't afford health insurance, and I can't afford to go to the doctor. So I basically want to know what your general stance is on helping out people like me.
Are you in school? Are you working? Or
I'm graduated.
you've graduated?
Criminal justice degree.
Okay. Are you employed or looking for work?
Currently
Or
employed, yeah, I'm a truck driver.
but there's no insurance offered through your employment.
Not at the moment, no.
Yeah. I'm sorry. I had no idea that you were even being so impacted today, and I'm very concerned for your health. Have you had this checked out at all?
Not at all.
I think you need to do that. Go to the emergency room or something.
It's been a little less than a year. It started like last summer, so I'm planning on.
Don't wait. Don't wait. These are not things that, it's your life. And I want to get to answer your question about healthcare policy, but I want to make sure that you're okay. Not a healthcare provider in any way, so I don't know anything about these kinds of symptoms, but I'm very concerned for your health and well-being.
It comes and goes.
Yeah, that's a problem.
It happens for like every day for like a week, and then it stops for like 2 months, and then it comes back again.
Okay, I'd like to talk to you afterwards. If that's all right. You are the exact example that embodies why we need a complete reform of this system that we have called a healthcare system, but it's really not a healthcare system because people like you exist all across the country who are potentially facing serious health problems or are facing serious health problems and are not able to get the care that you need. It's outside of reach. Even for those, we still have tens of millions of people who are uninsured like yourself and can't afford to go to the doctor, especially when you need it most. But there are tens of millions more people who are insured, but who have such high deductibles that ultimately, even in the position that you are in now, that they still can't afford to go in and get that care because of a $15,000 or $20,000 deductible. The system that we have now is a profit-driven system that benefits big insurance and big pharma to the detriment of the American people and our health and well-being as a country. This is at the heart of what needs to change and why the change that we need to bring about cannot be just tweaking around the edges. We have so many people who are underinsured in this country who are not represented in the statistics when people paint a rosier picture than one that actually exists. I've met and spoken with so many people who have some of the best in the platinum health insurance plans, who pay a ton of money every month in their premiums, but when they've had to go in for a surgery or they've had a car accident, a motorcycle accident, they've found that they don't have anywhere near the kind of care or coverage that they can afford, that even after paying all this money, they are not able to walk in and get that care. What we need in this country is a guaranteed health care system for every single American, no matter where you live or how much or how little you make. I've looked at the systems that exist in developed countries around the world, and I think one that would work best here is loosely modeled after Australia. I call it a single payer plus plan, where there's guaranteed quality health care for every single American, while still allowing the choice and the option for those, if you would like to purchase supplementary private insurance or your employer has a good plan that you're happy with, of course you have the opportunity to stay with that. But that does not in any way undermine your ability to get the health care that you need when you need it. It is absolutely unacceptable that in the United States of America, in a country where for so long and continuing today, we spend far more on health care than any other country in the world, and yet we have worse outcomes, and so many people just like you who can't get the care that you need. You haven't gone to the doctor because you don't want to know what the bill would be, and you know that you couldn't pay for it. But your life is on the line. Your life is on the line. It sounds like draining of spinal fluid, cerebral spinal fluid. It's a pretty serious thing. It's not something to mess around with. And whether it's you or many other families who are in this situation, you don't want to have to think twice about the life of your loved ones hanging in the balance because you're worried about the bill that's going to come in the mail. This is an issue that I was asked about earlier today. I did an interview with your local newspaper, and they said, but how do you get it done? How do you get this passed through Congress? It's not going to be easy, but not for the reasons that you think. It's not going to be easy because of the huge amount of influence that big insurance and big pharma have over members of Congress on both parties. It's not really the partisanship, I think, that is the biggest barrier. It's this pay-to-play culture in Washington where you have lobbyists actually helping to write our legislation that impacts our lives. This healthcare crisis that we're facing in the country is not just impacting Democrats, it's impacting Americans across party lines who are crying literally for our lives and our health and well-being. So I am confident that we will come together as a country to find the solutions that we need, but we've got to make sure that our leaders in Washington are actually working for our well-being and not for the profits of big insurance and big pharma.